How did ancient people survive tooth pain without dentists, anesthesia, or modern medicine? Tonight, if your tooth starts hurting, you can take a painkiller, book a dentist appointment, and probably save the tooth. But for most of human history, none of that existed. No clinics, no toothpaste, no antibiotics, no anesthesia, and yet, people still had teeth. Archaeologists have discovered something surprising. Ancient humans were dealing with cavities, infections, broken teeth, and unbearable pain thousands of years before modern dentistry was invented. In fact, some of the oldest dental procedures on Earth are older than the pyramids, which raises a disturbing question. How did ancient people actually treat their teeth when there were no dentists? The first answer is simple: they suffered. Tooth pain was one of the most feared problems in the ancient world. Unlike a broken arm or a cut, infected teeth never stopped hurting. The pain could last for weeks, months, sometimes years, and infections were deadly. Before antibiotics, a tooth infection could spread into the jaw, the bloodstream, or even the brain. People didn't just lose teeth, they lost their lives. Archaeologists examining ancient skeletons regularly find evidence of severe dental disease, rotten molars, abscesses, bone damage around infected roots, teeth worn down almost flat, and strangely enough, this became worse after humans invented farming. Hunter-gatherers actually had better teeth than many early farmers. Why? Because agriculture changed the human diet forever. Once people started eating large amounts of grains, bread, and sticky carbohydrates, bacteria in the mouth suddenly had endless fuel. Cavities exploded across ancient populations. Some early farming societies had cavity rates over 10 times higher than Ice Age hunter-gatherers. Ancient bread also contained tiny stone particles from grinding tools. Every bite slowly sanded down the teeth like sandpaper. Imagine eating bread every day that slowly destroyed your mouth. That was normal life for many ancient civilizations. And without modern treatment, people tried almost everything imaginable to stop the pain. The ancient Egyptians believed tooth problems were caused by tooth worms. Not actual worms crawling visibly from the gums, but invisible creatures believed to burrow inside the teeth and create pain. And surprisingly, this idea survived for thousands of years across multiple civilizations. Even in medieval Europe, many people still believed tiny worms caused cavities. It sounds ridiculous today, but when someone's tooth suddenly rotted from the inside out, they needed an explanation. Without microscopes or bacteria theory, worms almost made sense. The Egyptians created some of the earliest known dental remedies in history. Ancient medical papyrus texts describe mixtures made from honey, herbs, minerals, and crushed plants applied directly onto painful teeth. Honey was especially important. Modern science has shown that honey actually does have antibacterial properties, so some of these ancient treatments may have genuinely reduced infection, not because they understood bacteria, but because certain natural substances accidentally worked. The Egyptians also used primitive tooth cleaning powders. Some recipes contained crushed eggshells, ash, powdered ox hooves, and pumice. Imagine brushing your teeth with burned animal parts and crushed stone. Painful? Probably. Better than infection? Possibly. But Egypt was not the only civilization experimenting with dentistry. In ancient Mesopotamia, medical texts describe treatments involving oils, herbs, beer rinses, and heated tools. Some treatments involved literally burning infected tissue near the tooth, and yes, it hurt exactly as much as you think. Meanwhile, in ancient China, people developed herbal remedies using ingredients like ginseng, salt, and tea. Tea is particularly interesting because certain compounds inside it can reduce bacterial growth in the mouth. Again, ancient people didn't understand microbiology, but through centuries of trial and error, they discovered remedies that sometimes helped. And then there were the Greeks. Ancient Greek physicians began studying teeth more scientifically. The famous Greek physician Hippocrates, often called the father of medicine, wrote about tooth decay, gum disease, and extraction techniques over 2,000 years ago. Greek doctors recommended cleaning the mouth regularly and reducing certain foods believed to damage teeth. Some even attempted primitive dental surgeries, but nothing compared to what archaeologists discovered in ancient Pakistan. In a region called Mehrgarh, researchers found human teeth that had been drilled nearly 9,000 years ago. 9,000. That makes them some of the oldest known dental procedures in human history. The holes were incredibly small and precise, Researchers believe ancient people used bow drills, tools normally used for making beads or carving materials. Think about this scene for a moment. A person sits still while another human uses a spinning stone drill on their infected tooth without anesthesia, thousands of years before metal tools even existed, and somehow, some patients survived long enough for the drilled teeth to show signs of healing, which means the procedure may actually have worked. Ancient dentistry was brutal, but sometimes brutal was better than dying from infection. Eventually, when pain became unbearable, the final solution was simple: remove the tooth entirely. Tooth extraction is one of the oldest medical procedures on Earth, and ancient extractions were horrifying. There were no sterile tools, no numbing injections, no painkillers beyond alcohol, herbs, or physical restraint. Sometimes the tooth was loosened slowly with metal instruments. Sometimes it was simply pulled out with force. And if the roots broke inside the jaw, the nightmare became even worse. Roman medical writers later described specialized dental tools that looked disturbingly similar to modern extraction instruments. Some wealthy Romans even used gold wire to stabilize loose teeth. Yes, ancient people were already experimenting with primitive dental work nearly 2,000 years ago, but ordinary people rarely had access to skilled treatment. Most survived with homemade remedies. People chewed medicinal plants, rinsed with alcohol, applied oils, garlic, mint, salt, vinegar, or smoke. Some cultures used willow bark for pain relief. And this is fascinating because willow bark naturally contains salicin, a chemical related to aspirin. Without understanding chemistry, ancient humans accidentally discovered natural painkillers hidden inside plants. Across the world, different civilizations independently searched for ways to survive dental pain. The Maya in Central America even performed early cosmetic dentistry. Archaeologists discovered skulls with decorative stones embedded into the teeth. Tiny holes were carefully drilled into front teeth, and gemstones like jade were inserted. And incredibly, many were done so precisely that the teeth survived without major infection. This required shocking levels of skill. Ancient dentistry wasn't always primitive ignorance. Sometimes it involved genuine technical knowledge developed through generations of experience. But despite all these treatments, most ancient people still lost teeth early. Many skeletons from ancient civilizations show adults missing huge numbers of teeth. By old age, some people could barely chew solid food anymore. Tooth loss changed entire diets. Soft soups, porridges, and stews became essential for elderly people who could no longer bite properly, and the problem became even worse during the Middle Ages. Sugar slowly spread across Europe, and dental disease exploded again. At the same time, professional dentistry barely existed. Many tooth extractions were performed by barbers. Yes, barbers. The same people cutting hair sometimes also pulled teeth. Traveling tooth pullers performed public extractions in marketplaces while crowds watched. Some even turned it into entertainment. Music played, people gathered, and then someone screamed while a rotten tooth was ripped from their jaw in front of everyone. The history of dentistry is far more violent than most people realize, and yet, for thousands of years, humanity kept experimenting. Slowly, knowledge improved. By the 1700s and 1800s, dentistry finally began transforming into a real medical profession. Better tools appeared. Understanding of infection improved. Anesthesia was eventually introduced, and suddenly, something that terrified humanity for millennia became survivable. Today, a dentist can repair damage that would have killed someone in the ancient world. A simple root canal today may look unpleasant, but compared to ancient dentistry, it is science fiction. Because for most humans who ever lived, tooth pain meant fear. Fear of infection, fear of agony, fear of losing the ability to eat, and sometimes, fear of death itself. The next time you sit under bright dental lights, hearing the sound of a modern drill, remember this: there was once a time when the alternative was a stone tool, a cup of alcohol, and 4 people holding you still. And somehow, humanity survived long enough to invent the dentist.